Nagbabalik po ang Good Morning Kuya, February 22, 2017, 6:18 in the morning. Of course, Usapang Pangkalusugan with Doc Pebbles.
Hi, Kong. Hi,
Yeah.
Oy, today is, our lecture today will be on bursitis. Have you heard of bursitis?
Bursitis.
Bursitis.
Inflammation.
So, that's right. Yeah, itis, inflammation. But the bursa, have you heard of the bursa?
No.
A bursa is actually, we have several bursae in our body. Technically, it's a sac that is filled with fluid and it aids in lubricating or in the motion of the joint. Therefore, nakikita natin siya sa balikat, meron din tayo sa siko, meron tayo sa hip, sa tuhod, at saka behind the ankle, no? And those are the areas that where you find the bursa in between the muscle and the tendon para hindi sila nag-rub against each other. So, the thing is, minsan namamaga yan, kaya sumasakit. Let's say, natamaan, no? So, it can either start from a trauma or any repetitive action. Halimbawa, you started the vigorous activity and you didn't do enough conditioning exercises, then pwede siyang mamamaga. Kasi yung muscle natin na nakapatong sa buto, magko-contract na, and that will cause a localized inflammation and it will cause pain. Commonly yan nakikita natin sa shoulders. Halimbawa, we start doing upper limb exercises and then suddenly you have shoulder pain. The thing is, pagka hindi siya na address properly, lalo na yung certain joints of our body, including the shoulder, nagiging prone siya to stiffness. Kasi because of the pain, hindi gagalawin ng patient, and then eventually, pag nawala ng inflammation, matigas na. Yun yung nakikita natin, kumbaga frozen shoulder na tinatawag. So, bursitis can actually be diagnosed because through clinical history of the patient. So, usually the onset is quite slow and it gradually builds up with regards to the severity, the frequency, and the intensity. And usually nga it's related to an activity. But it can also be sudden onset. Yung biglaan na lang sumakit yung balikat. No? It is not usually, well, diagnosis when I say it's clinically, because even if you do x-rays, you won't see the bursa. So, yung diagnosis niya, history ng pasyente, at saka pagka physical exam mo yung pasyente, usually the bursae are also quite tender. So, how do we treat this? Basically, treatment, you can still do your local anti-inflammatories, the usual warm compress, topical analgesics, and physical therapy. So you can start conditioning the joints that are, the muscles around the joints that are involved. But for those that have recalcitrant symptoms, no, yung paulit-ulit, then pwede tayong mag-inject ng tinatawag dating steroid para matanggal yung inflammation. Oftentimes, that's quite effective, but there are few cases wherein they don't take effect, no, and you can actually repeat it, but again, the side effects, like what Kong mentioned, no, a very, very few would end up having an excision of the bursa because of failure of treatment. So, most often with just conservative management of pain medications combined with your physical therapy or a steroid injection may help. And to prevent it, mas maganda sana if you do repetitive, if you're intending to do some exercises or vigorous activities, you should start doing first some conditioning exercises.
Stretching.
You start low and slow before you gradually build up your activity level so you can avoid injuries to that area.
Soft tissue siya.
Soft tissue siya. So here makita natin siya dyan sa ating screen, no? Yung knee bursa, we have one in front of the kneecap, no, prepatellar bursitis. We have one also at the side of the knee, in the inner side of the knee.
Ito yung kulay blue.
Yes, yan yung kulay blue, no. So kung titingnan natin, ay, yan, no, you have your prepatella behind your quadriceps. Ito yung tinatawag dating pes anserine. Actually, dapat nasa medial side siya. Tapos semi-membranous, nandun din siya sa inner side of the knee. So, these areas are the ones wherein, if you notice, between the bone and the muscle, you have that bursa. Between the skin and the bone, you have the bursa. So technically, it really is a protection against friction.
Does that tissue tear?
Hindi naman.
Hindi.
Pero
It's very
dumadami yung fluid. Kaya yun yung swelling na nakakapa natin. And the swelling can also be a sign of inflammation.
Yun ba yung sinasabi, kailangan i-inject para tanggalin yung fluid?
Oo, sa olecranon. Di ba yung ginawa natin kay Diego one time? Oo, that was an olecranon. Kaya it can also be associated to some systemic diseases such as gout, no?
Gout.
Or rheumatoid arthritis. Kay Diego noon, di ba, laki nung dito sa siko niya. Tapos, that's an olecranon bursa. And then, when we extracted it, it was a mixture of fluid with, yung serosanguinous with a little bit of blood. And then, after nun, hindi na siya nag-appear ulit. Pero kay Diego kasi gout yun
Gout yun.
Hi, Degs!
So ito,
ayun.
nag-inflame siya.
Yes. And then, usually, yan, anti-inflammatories, like, you can start them first on paracetamol or if you want other stronger NSAIDs. And then, kung hindi mawala, try nyo yung PT, katulad ng ultrasound. Kung hindi, pwede nating i-extract yung fluid. And then, you can put in a steroid para hindi na siya mag-reaccumulate.
So,
Ayan.
hindi yan masabi, for example, in time, numinipis o totally nawawala?
Kasi the sac is always there.
It's always there.
Yeah, it's not just the period of inflammation. Yan. So, pagka may mga bukol-bukol, hindi automatic na tumor, maka yung pala bursitis lang pala.
May tubig-tubig. Lalo na pag dito sa mga
Siko,
joints.
yes.
Joints.
Gout yan kadalasan.